The first thing we're going to talk about is teeth health. Now, teeth and gums work together to create great health. The second thing we're going to talk about is, oops, let's go back one. Well, let's just talk about teeth health for a minute. So to keep your teeth healthy is, of course, you want to brush your teeth all the time. You want to brush them after you eat food, especially after you eat sweets. You want to do that. You want to stay away from soda and acidic types of highly acidic soda, right? It's just all so bad for your teeth. And we can see that in so many studies. But other than that, what can you do to really create better teeth health? Because your teeth actually do show what's going on in the rest of your body, which we don't often think about. You know, we could have problems with tartar or plaque or other things that cause gum disease. And so what do we do with that, and how do we minimize that? And are there things that we can actually do to help stop or reduce the discoloration of our teeth and other things, other problems that we might have? And there are things that you can do with essential oils that will help all those things. But the ones that we're going to talk about today are really simple, and it's going to be the first one. So first of all, to have really healthy gums and teeth, we want to brush our teeth, okay? And you want to use it with something that's actually going to help, that doesn't have, you make sure that you choose a toothpaste that isn't going to be a problem, because that's what they're like, ooh, this one's sweet. I like the way it tastes. Well, it has sugar in it. Well, let's see. I'm brushing my teeth to get the sugar off, and then I'm going to place sugar on it. I think there's a problem there. And so we might want to look at the ingredients and make sure that we have things that are going to help our teeth health. Remember that there are hundreds of thousands of bacteria in the mouth every day. Crazy thought. Oh, and if we aren't taking care of what's happening in it, it's good stuff. It's supposed to help you be able to digest your food. But if we're not taking care of those teeth, then that's the first place we're going to have some problems.
So some manufacturers actually put sugar in toothpaste.
Read most of the labels.
That's crazy.
That's
like putting dirt in a bar of soap, you know? I mean, why would you do that? That makes no sense.
Extra surfactant, I don't know, extra scrub level. But yeah, it's not that great, right? Yeah. So you're putting it on and brushing it off. Okay, and it's going to get in between your teeth. And I don't know, it just doesn't make sense. And then they put things in it that are actually poisonous. So you can choose toothpaste, and I suggest this one, the On Guard toothpaste, because it's going to help the body with the immune system. It's going to help with that extra bacteria, remove the extra plaque, help your teeth look whiter, cleaner, because you don't have stuff that's sticking on it all the time. Now, Mark might be a little bit, subconscious. We all get a little subconscious about how our mouths respond. But there are things that you can do for discoloration too, and we can talk about that one on another day, probably.
All right.
We might get that one today, but we'll see what happens. So that is what you want to think about first, is you're going to use a great toothpaste, okay? Chewing gum. Now, people don't think about that, and maybe you don't want to chew gum, but just remember, if you're going to chew gum, and choose a gum that is going to actually help stop your food cravings. And I choose this one, Slim and Sassy gum, because not only does it help metabolize your foods, and it also helps with teeth health because it cleans them. What? Yes, xylitol can help stop cavities, and dentists love it, and it's in here. So you can, and this has non-sugar sugars. So in other words, xylitol is a non-sugar sugar. It's a wood alcohol. It's not a wood alcohol. Anyway. Now I'm going to say the wrong thing. So it's
sugar alcohol.
Sugar alcohol. Thank you. And stevia. And those are two really important ones that can help you have tooth health. There we go.
Yeah, that's super cool. There is actually a sweetener that actually promotes dental health rather than creating cavities. It's pretty amazing.
Pretty awesome.
Yeah.
Okay, so gum health equals tooth health. So if you're doing things that are going to hurt your gums, if you're using a toothbrush that's really firm, it's going to hurt your teeth. But also, if you are not doing these kinds of things and keeping the tartar down and so many things, you're going to actually have problems with your gum health. Okay, so make sure you're doing things for gum health. And we've already just talked about them if you didn't know. So do those things and you'll have healthier gums. You can do some other things too. One of the things that I like to do is consider extra ginger or clove, cinnamon. They're also good, but you have to be careful when you use those because they're hot oils. And so you can use a carrier oil with it, stick it on your finger. You can rub it around the top of your gum line. If you're having some swelling on your gums, you can use ginger, clove, or helichrysum, but ginger and clove actually help with that. I said, what did I say? Melaleuca can help too. Anyway, so these are wonderful tooth gum line helpers so that you can undo or reduce on gum disease. I gotta be careful with that word. Gum problems
right,
problems that are inflamed problems. You can, and oh, I know the other one was On Guard, and for some reason it's not in my stash right here. Okay.
These are really great, but to Cynthia's point, be careful with the really hot ones like cinnamon and clove.
Cinnamon. That's the one I was saying.
Because you do need a carrier oil with those. I can testify that these are sensitive areas of your body, and
yeah,
they're
really
very
true.
effective, but you got to be careful with using a carrier oil.
It's true.
Okay,
next, tongue health. So we don't often think about the tongue. We use it all the time. It's what makes us be able to, helps us taste things with the olfactories and as well. And but we don't think about it revealing some other health issues. So we're just going to talk about what you might see if you look at your tongue. Now you don't have to stick out your tongue, but if you have that mirror close by, remember we licked our teeth, you can see anything that's happening there. You might want to consider, flossing once a day too. So let's look at other health issues with tongue. One of the things that has recently been revealed is to brush your tongue. Whoops. So check for ridges and check for color too, okay? You're going to brush that tongue. And why do you looking at ridges? Because ridges can often identify that you're having some kind of a health issue. And so you can and if your tongue's white, it also could be having a tongue issue. It could be the result of not drinking enough water. You can get a white tongue. I'll just show you tongue. There. Remember our water thing? Water becomes really important to tongue and mouth health. Really super important. You could also be dealing with other things that like thrush. Talk about that. We got go back one. Yeah. Thrush, candida, and indentation. So we talked about the indentations. Now we're going to talk about the thrush or candida. So babies get thrush. We don't often call it thrush in adults, but it's actually a fungal experience that your body can have. And there are some things that you can help reduce the compromised immune system and reduce the outgrowth of that, which goes up through your gut and shows where in your mouth, and you can see it on your tongue. So you can also take a really good probiotic, and you can also flush out your system and help it be stronger so that the good bacteria doesn't get overtaken by the bad stuff. This is how you do that one. You can do the protocol for that. Plus, you can also use oils for that as well. But just remember, brush the tongue. Think about the On Guard is another super good one for gut health, which is interesting. Okay. Oil pulling. We've talked about that before, but just think of putting a teaspoon of oil, stick one of these oils on it. You can use the clove this way. You can use the ginger this way. You can use the On Guard this way, and swish it around in your mouth with a teaspoon to 2 drops. 2 drops of this with a teaspoon of oil. Do it for
a teaspoon of fractionated coconut oil.
Oh yeah. I'm sorry.
Okay.
I'm getting ahead of myself. I'm so excited about getting through all of this. I want to make sure that we talk about it and have time to talk about everything else about it, because there are literally probably a good 50 oils that help with your tongue, throat, and general gum health. And so I'm going to tell you the ones that I like and ones that I've used that have really been beneficial for me. And then you can decide which ones you have liked the best out of those two. Okay. Throat health. Okay, you can stop the annual problems by doing a few things. One of the things that you can do is use a really good mouthwash. And this is On Guard. Oh, we keep talking about On Guard because it has all these great antibacterial properties so that it helps reduce antibacterial and antiviral problems within your system. And you swish it around in your mouth, swish, 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 and gargle with it. Helps that throat, okay? It's going to help get rid of the toxins in your throat. So you've oil pulled and now you're going to swish every day. You can do tons of good with your health there. Now you might, let's go to the next slide. Was just the gargle and swish. Now we're going to go for one more. Okay, now we're going to talk about stinky breath. Now the reason why we're going to talk about stinky breath is it can be caused by a number of things. It can be caused by not drinking enough water. It can be caused by bad problems in your gut, which is super common. It's actually often more in your gut than it is in your mouth, and it's coming up from your gut. Kind of gross, but it's what we do. We're all one system, right? It doesn't have a break off and suddenly you're the stomach and suddenly your other parts. So if you have stinky breath commonly, then you might be dealing with a lot of stress, but you also might be dealing with some of these other problems. So you can do things like use peppermint regularly. You can take it internally. You can take it into little droplets. And that'll help with just the mouth, right? But let's pretend that the stinky breath is your gut. So what do you do for that? Well, you can take Digestin on a regular basis, and you can take it orally, and you can stick it on your tummy. And that can help a lot with any of the stinky breath problems that are coming up from the gut. And don't forget, please remember your water, because that's going to super help. So if you're doing the toothpaste, that's going to help. Then if you're going to do the Digestin, the peppermint, these are all going to help maintain your breath so it doesn't stink. And remember, brush the tongue, do the mouthwash. I mean, they sound really simple, but you can create this in a routine on a daily basis. So if my routine would look something like this, I get up in the morning. Oh, that's a good idea. I drink some water. That's the first thing I'm going to do when I get up in the morning. Why? To get my system cleaned out and to make it function better. Then after I drink some water, I'm going to brush my teeth. Awesome. And then I'm going to gargle. And if I'm not feeling the greatest, I might do an oil pull with On Guard ginger or cinnamon or clove. That's 4. Now I'm feeling better. Now everything's feeling a lot better. Okay. So what am I going to do now? Well, now that I fixed that stinky breath problem, I'm going to take one of these, depending on where I am in the protocol. So you're going to look at the protocol, learn the protocol. It tells you on the back how to use them exactly. Just do it as directed and you'll be great. And that's it. That's what you do. You get up in the morning, and instead of just rolling out of bed and going downstairs and grabbing something to eat and running out the door, you do that first. What does it add? Another 5 minutes of your life. What's it going to save? Thousands of dollars in gum disease and throat problems and mouth issues, which is actually the health of your body. We're going to talk just a little about cavities and how that's also,
stay here.
Yeah, also a problem with stinky breath. So if you've got something going on that is cavities related, you can have stinky breath too. So what can you do for that? Well, first of all, you should be going into a dentist regularly just to keep your teeth clean, keep the plaque down so that you don't get gum disease. But you can also help by putting some of these oils on the area that's affected, and that will help reduce the bacteria growth for you, right? So clove is known to be a great antioxidant. So that's my one of choice. And then just put a little bit of that carrier oil on that area first and then stick that on. And for me, that's been a lifesaver.
Clove is one that a lot of dentists rely on.
Yeah.
Correct?
Yes,
yeah.
I have had my tooth actually packed with clove after a root canal because it works. and they all know it works. So it's awesome.
Yeah. So this is pretty important for those of us who are coming out of social distancing. I haven't worried about it too much when everybody's 6 feet away, but you know, now it's a little more important.
Speaking of which, have you noticed behind those masks? Have you ever gone inside of that and gone, woo?
Ooh, yeah. glad I've got the mask to catch that. Huh?
Yeah. Well, yeah, now you don't. So remember, people, that's a problem. Okay, so now if you have this kind of thing going on, if your voice just feels weak or hoarse, I'm going to go back to water again. But also during the daytime, you can use like On Guard drops. So you can use the On Guard drops, or you could use the Breathe drops, or you can use, came right open, or you can use the ginger drops. And you can choose those, and they'll help soothe these voice things, okay? So I have people that they love them so much for when they're singing, and they always have one with them because it really helps just soothe that whole area. And that's great to do, right? Because it's less inflammation is less inflammation in the body. It's fantastic.
And diffusing at night, I've been kind of alternating between Breathe and On Guard at night, and I just have a diffuser right by my bed. I turn it on before I go to sleep, and it runs all night, and it's terrific.
It's really helped with his snoring.
Yes. Oh yeah, with snoring, it's helped a lot.
Because that's also an inflammatory response, right? Dry throat and all this. So if you've got a diffuser at night, you're actually putting more humidity in the air, but you're also creating this less inflammation with these things. So
and I find and it helps my mood as well, because I'm breathing those oils that help me when I wake up.
And it means you slept better.
Yeah.
Yeah. Awesome.
I don't hear myself snore that much, but
it wakes you up sometimes. How do I know? Okay, so we already talked about try water plus oils, right? So the digestion, the peppermint, the On Guard, the ginger, we talked about that already. Make sure you're considering those. You can bring them with you. You can have them in your purse. You can add them to your water. Yes, you really can. And you can stick them on your tummy. You can smell them. You can put them sublingually. I mean, there's so many ways to use all of these things to help for your tongue health, for your throat health, for your teeth health, and your gut as well. It's awesome.
Fantastic.
Okay, now we haven't talked about these, so this is a little extra add-on. Here's a cold sore roll-on that you can use. Now, you know, not all of us, but many people get cold sores. You can just use plain tea tree oil. It says Melaleuca, that's tea tree. So you can even use just plain tea tree oil, or you can do a whole set. I'll tell you what they're going to help you with, okay? Well, I'm going to tell you about one because we've talked about most of them, and we haven't talked about helichrysum. So helichrysum is my all-time favorite for any kind of stop any kind of a blood flow issue that I have. Helichrysum is my first go. So like if I have a little sore, like I cut myself today, I couldn't find my helichrysum, so I used On Guard, which also works, which is interesting. But I usually grab that, but it also helps with any kind of, pain issues that you might be experiencing while you're dealing with like a toothache or something. It can help, and you can stick it right on the outside, or you can put it on a little cloth right by the tooth inside, and you can help that way too, which I do if I ever have that experience, and I have. So I've done that before as well, and it's really helped significantly. And this one was supposed to be the first one, the other one was supposed to be the end one. So we want to see you next week, and we do want to thank you. And we want to thank you for being here. And we hope that that's given you an idea of all the wonderful things you can do very, very easily. If you have good health in your mouth, you're going to have better health for your entire body. Because, if you're getting infections or inflammation in the mouth, then it's going to affect the entire body, because there is massive ways of blood flow that's going up into your mouth, right under your tongue, and you're close to your brain, that you're going to be affecting different parts of your body. If you've got tooth decay and it's gone up inside of the tops of your look how close that is to my brain,
Oh, yeah.
you know?
Yeah.
And so that's going to get affected too. So
Sinuses.
yeah, and your sinuses are going to be affected, and all of these things affect each other. But just remember, if you can keep this healthy, you're going to have better health all the way up and all the way down. So that's why it's a highway. It's the super highway for health for your body, is that mouth and tongue. So go ahead, take care of that. See if you can create some better health for yourself and try some of these incredible combinations for you this week. And we'll see you next week.
Okay.
Take care.
Take care.
We're going to move right into our Zoom call portion now. And as soon as we move off the Facebook, we'll just keep recording this. So we'll stop the live stream for that, but we'll keep the recording going because we want to keep live for you that are here to ask questions. So I hope you have questions. If you don't, I'm gonna ask you to consider asking questions. You can smile and we won't talk about your teeth. But we had a few people on. I think we have a few more that were on. Are we still there? Check the view. Gil and Stacy and a number of people were going to be on tonight. That's good. Okay. So any questions that you might have that you hadn't considered with what you heard?
I always forget about oil pulling.
Yes.
It was a good reminder.
Yeah, it's really interesting. I'd like to talk a little bit about what I do if I have a tooth problem, because you can actually stop the decay. And if your tooth is super healthy, you can actually stop it from needing extensive dental work, which is awesome. I'm not saying don't get the dental work you need to have done, but you can often stop things. For instance, if you've got a sore tooth, I'm going to say if you have a sore tooth, and you can put the clove on it and around it, and you can do it, like I said, use a carrier oil, but you can do it all day long. You can do it through the night and all day long, and it will stop any kind of, I've done this, and I will tell you what it's done for me. It stopped any kind of abscess. It's actually stopped me from needing root canals. And I've actually, if I'm getting a zinger in my tooth and I'm like, oh no, it's a root canal problem, if I'll just do that with the clove, and then I'll put the helichrysum on the outside. If I've had a tooth break, I'll do it on the inside, just because that'll help with any kind of pain issues I might have. But on the inside, I will do clove on the tooth, and it's the only one I've used significantly for that. But I know the other ones work well too. But just because I know that they pack with dentists pack with this for infection specifically. I've had it done multiple times in my mouth, and it's on their list of accepted practices. They have it in their offices, and so you can have clove put into your mouth, clove oil put into your mouth, and pack that if you get a root canal. And I'm like, well, if I can do it with a root canal for infection, then what else can I do with it? And that was my first thought.
Oh, yeah.
And so I personally have used it to stop root canal need. And I've seen that in my son, who is a doctor of chiropractic, and he has done that successfully as well. He's like, I have really good health. I do really good things for my body. I'm taking care of myself, and I don't want a root canal. So what can I do? So in his studies, he came up with clove oil as well, which is really interesting.
Jeanette, how have you used oil pulls?
Well, the times that I have used them mostly is to draw out, like when I start to feel sickness coming on, like a cold or something like that.
Yeah.
And I'll use with the On Guard and try to pull those toxins out of so that it doesn't get into any, and some, usually like it doesn't develop into the further, it like stops it before it continues on. But I also will do gargle with I usually do Melaleuca, On Guard, lemon, and a gargle and swallow with that. So I'll gargle for a little bit so that it gets to the back of my throat, and then I'll swallow it because all of those are good to get like the bacteria in the lower part of my throat.
Yeah.
And then if it's like comes on really strong and like maybe it's a more intense sore throat, then I actually add a little drop of oregano. And not many people can tolerate that, but I can. Because it's very intense. Some people can't even tolerate the On Guard, but I'm fine with all of that. And it's like momentarily like you're like, ah, but it totally nips it in the bud, and it doesn't develop into further.
You must be part Italian if you can do that. That's like a week's worth of pizza in one drop.
Seriously.
Yeah. Maybe I'm part vampire because I can't handle it. I don't know.
Well, that's good to know. Thanks. That was good stuff.
That's awesome.
Gil, what? Anything jump out at you tonight? Anything bite you?
I just barely got on. I was doing some electrical with my son, thinking that I could finish and be on, and I was done by 7 o'clock, but I couldn't get on with my phone. It said, "Oh, you don't have the latest version. Update now," and it wouldn't update. So I drove home as fast as I could and got on.
Well, I'll tell you everything we talked about. A protocol of every day doing this, okay? In the morning, you drink water, and then you brush your teeth, and then you're going to gargle. And then if you need to, if you're on a system, if you've got got bad breath, make sure you're doing this, or your tongue's white. Do this to help reduce the candida overgrowth, so you get that back in good form. And if you chew a gum that has xylitol in it, so that it helps your teeth, not hurt your teeth. And then use peppermint during the day for any kind of like, oh, my breath's bad right this minute. And then you can use ginger or digestin or clove for any, well, that's separate. Digestin for your gut, because gut often causes bad breath. And then the clove and ginger and cinnamon are super good for the teeth itself and for the gums for gum health. And you can just put a little bit of fractionated coconut oil over it and then stick it on. I actually stick it on just raw without it, but I don't want to say that to, the masses, except for the masses that are going to hear this, because it works. And I haven't had any problems with it causing any kind of irritation, but it could. And so you can do that. You can put it on a little cloth, and you can actually stick it next to the tooth, inside the mouth, on the outside, inside the gum, and just let it sit there, which I have done very frequently, and help that.
There you go. You got the Reader's Digest version.
That was the Reader's Digest.
A few days ago, I noticed I had a little canker sore on the outside of my gum, and I gargled with the mouthwash for 2 or 3 days and gone. That's all I did to it, was the mouthwash.
That's so awesome.
That's
Great
stuff.
Yeah, cold sores, cankers on the inside often you can reduce them with that. I haven't done that what you did. That's a good idea. I'll have to do that one. What about you, Stacy? Anything that you found that's been beneficial for you?
No, I just love all the products. I haven't really had a lot of oral health issues, so I've been grateful for that. But yeah, I do know that the On Guard toothpaste really helps. Like even just the toothpaste, helps if I feel some sensitivities with my gums or something. I mean, John has a toothpaste, so sometimes I'll use his. But if I switch back to the On Guard, I feel like my mouth is cleaner, and my gums aren't as sensitive, but yeah, I know, I'm sorry. Yeah, not a lot of.
I haven't had a cavity since I started
Jeanette, you're
using it.
first.
Oh, sorry.
Sorry. Yeah, I was just wondering if anybody's tried the new formula toothpaste.
Yes.
No? Yes? Oh, you got it right there.
Yeah.
It's great. It's good. 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 2 thumbs up.
What about, have you guys used celery seed oil for oral health?
You know, I haven't used celery seed oil for much of anything.
Have you?
Well, no, but that's like I think when they introduced it, that was one of the specific things I recall. I'm pretty sure it was celery seed oil when they introduced it to the
Period.
that it was one thing that they said it helped with oral health. So I was just wondering if anybody actually had tried that.
The only thing that I think when I think of celery seed, I always think of ligaments. That's what I think of. So, because I know it's really helpful for ligaments, but I've not used it for that. But now you got me curious, and why don't you go back and read your notes and tell us next week? That'd be fantastic.
Okay, I'll follow up for you.
I've been using the new toothpaste. It's a little milder flavor, so I like it. That it's not quite as, doesn't bite my tongue quite so much. And the help that it gives to your teeth, I'm really anxious to see how that plays out over the next few months, because of actually helping to replace the
Enamel,
building blocks of your teeth. It's pretty exciting to me.
right? Yeah.
Yeah.
I'll be
Oh, I
getting.
should mention that.
Yeah.
You should have mentioned that. We just mentioned it. We're still recording.
Yeah, that's right.
So let's move off recording now, and thank you so much. You can stay on, but we'll just move off the recording. We'll see you next week.
Bye.
Bye-bye.